afternoon, everyone. I'm Shannon Dellum. I am one of the instructors with Community Memorial Health System's Health Aware Wellness and Fitness Center. Hope you are doing well. We made it to February 1st, 2021, and happy Heart Health Month. This is definitely one of my passions in regards to the past, coming up on 31 years this year in medicine. Starting out, I was barely 19 at Community Memorial Hospital, and I was hired to work in the coronary care unit, in our intensive care unit. And that love for caring for others' hearts is still beating strong today. I'm excited and honored to share some of this information that we have for you the next few Mondays. I think we've got 4 Mondays going here. If you're just now joining us, fantastic. If you're watching this later, even better, because I hope as you sit down and you have time to maybe catch your breath and really focus on the importance of taking care of your heart, that you find some moments to just kind of be and absorb it. It's really important. It is the leading cause of death, heart disease in our country. We certainly the past year have learned more and more, most of us, about the importance of our cardiovascular health in regards to the pandemic that we're living through right now with COVID. So keeping that in mind, this is going to kind of be a foundation for you for general health to help you along the way and also help each of us through this crisis. So as we come into things today, a few options to remember is if you want to take notes, I always recommend it because then you can go back and see what actually spoke to you as you jot down a few things. It's a lot of information in a quick 20 to 30 minute session, but it's invaluable. It is life-saving what we're going to talk about the next 4 weeks. So if you can join me in maybe getting your notes together, I have mine here. As you come to our little meetup, please remember that if you are concerned in any way about symptoms, something that you're actually experiencing yourself, we really want you to reach out to our Health Aware department. There's some free screening that you can have with our nurse practitioner, Andrea Ricketts. She can do some basic tests and definitely refer you to some of the top-notch care in our county for cardiology. I want to reiterate the importance of not taking just maybe what you learn on this video, but if you need to apply it and actually use it in life, you want to reach out always to advanced medical care. So that advanced medical care is definitely going to be starting obviously with our emergency room department, which is outstanding, our cardiovascular department, cath lab team, our surgeons, our cardiologists. We're very blessed in Ventura to have accessibility almost like no other in other parts of the country. So just know that if you're ever in question, you need to pick up the phone, you call 911, that's what they're there for. That's what we have them for. And we're so lucky here in the city of Ventura that every fire department member that we have has to first be a paramedic. So they're also going to be able to help and guide you through some of the things we talk about today, especially in the next couple weeks. So in coming to this, everybody just kind of take a moment, just take a nice big deep breath. Sigh it out. So the importance of our heart health, it is at the essence of everything you are. You can even think about it sometimes. It's the center of your body. It's the most important muscle in your body. And that's where today's topic is going to hopefully be of help to you. And if not to you, it could be to anyone in your community. One of the things we want to remember about cardiac emergencies in the past, I would even say 2 years alone, most of the cardiac emergencies I have actually been aware of outside of a hospital setting have been at the grocery store. They've been at a family barbecue. They've been in the middle of a church service. They've been in the middle of the parking lot at Trader Joe's. That was where my most recent one I encountered one was. So important to remember when we talk about looking for cardiac emergencies, it's going to be you and I kind of out and about. 4 out of 5 times it's going to be in just general public settings. It's not going to be in the clinical setting like maybe your doctor's office. It's not necessarily going to be in the hospital. So kind of keeping that in the back of your mind as we talk about this today. So in today's session, one of the most important things we want to remember is recognizing and how do we respond to the signs and symptoms of a heart attack. So when you hear people talk about triaging a situation, if they encounter a stranger or if it's a family member or loved one, what are they looking for? How do they recognize that this is possibly a heart attack or a cardiac emergency? And I want to reiterate before I get into details, if you're ever doubting and you don't want to carry that burden of even thinking about symptoms, pick up the phone and call 911. Right? There's kind of a misconception out there or misinformation that, oh, if I call 911, I'm charged. No, it's already paid for through our taxes. That's what we have them for, is this kind of community network that comes in and will do all that assessing for you. So I really want to reiterate that. If you're ever in doubt, if you were that person that's like, hey, I don't want any part of this, but please at a minimum pick up the phone and call 911. So the topics today can be a little heavy for any of us that have experienced it before, that have lived through a heart attack or have had someone around us experience a heart attack. We're going to give you some of the tools that you can look for. And I like to remind everyone, 2 or more symptoms, you're picking up the phone and you're calling 911. Time is of the essence. So I've had the privilege the past 30 years of working with some of the most brilliant cardiologists I've ever encountered, including even some of those through my own personal experiences down at even Cedars-Sinai and UCLA. Ventura has an incredible cardiac team. So in seeing the years that I've experienced their input, you want to look for certain things, but they can vary in regards to signs and symptoms. So what exactly is a cardiac emergency? Or do we possibly have someone having a heart attack? It's a possible heart attack. What are we looking for? I'm going to briefly talk about that. But in a heart attack, just to go over it, if you can imagine, I always like to give the example of, kind of taking your own fist and taking it and placing it right where your heart is. That's about the size of your heart, is going to be the size of your hand. And if you can imagine it, it's this muscle and it's this pump. And there's all this beautiful blood and arteries and capillaries and veins and things that run through it. And I always like to use a little example here I have. You can kind of imagine, it's like this kind of tree of life of running all this blood through the heart to make it pump properly. What a heart attack is when there is disruption of blood flow or blockage of blood flow to that muscle, which obviously can cause 2 things. One, can cause you to have irregular heart rate, right? It's an electrical issue. It can also start to cause you to have a functional issue and actually cause damage to the muscle. So you can imagine like the pumping mechanism. So kind of keeping that in mind, these signs and symptoms are often one of those things where someone is conscious, they're able to complain to you of symptoms, and then you can act quickly. So 2 or more of these symptoms, you're going to pick up the phone and call 911. So being aware of it, kind of just having that general education, and again, if you're ever second guessing it, I hear this all the time. Could it possibly be a panic attack? Maybe. Is it a heart attack? Maybe. Right? So they mirror each other sometimes with symptoms. Don't carry that burden of second guessing. You want to rule it in or rule it out. It is a win-win no matter what. So the key thing to remember nowadays when we talk about these things is don't carry that burden. 2 or more of these symptoms we're going to go over. You're picking up the phone, you're calling 911. Do not, please, ever get in the car and decide to drive the person to the hospital yourself. Why is that such an important part of responding now? You do not have the capability in your car, obviously, to provide an EKG for someone, to start running blood tests that are critical at that time, to start giving certain medications. When you recognize the signs and symptoms of a heart attack, you are truly the first responder. That is your role. You're going to call 911, get them to you, and nowadays, even where we live, there's this timeline you can imagine that we try to meet. It's a criteria of from the minute you recognize it, you pick up the phone, you call 911, that dispatcher is going to immediately notify the hospital. The right dispatch team is going to be sent to you that can push certain medications, that can do certain tests, and they're going to do all of that even en route to the emergency room or even straight into our cardiovascular lab or possibly even into surgery sometimes. So don't carry that burden. Know that when you're picking up the phone, you're calling 911, they're going to come and do certain assessments. It's going to be able to tell them, hey, we're not taking a chance with this. We're taking this person that's possibly having a heart attack and we're headed to the emergency room. If you go to put that person in the car, there's always that possibility of something really going wrong in between your house or the place you're at, the parking lot. Get the team that is fully capable of taking care of you on the scene. So please don't hesitate in calling 911. Absolute essence. Those that do that, those of us that choose to immediately pick up the phone and call 911, we increase survivability for someone having a heart attack tremendously. And you can go online and Google all the different, survival rates for people that had 911 called within the first 10 minutes to those that didn't, that sort of thing. But in sticking to American Heart Association, American Cardiac Association, every single thing you can think of in regards to American Medical Association, we want you to not second guess yourself. Don't let that stubborn uncle or neighbor, we all have them, right? Say, no, this isn't a heart attack. Don't call 911. If you're paying attention to what these signs and symptoms are, I don't know, unless you're a true prophet, you can't really normally tell. Go ahead and call 911 and have those tests start en route. And then every minute is muscle. Probably one of the things I've learned the most in triaging situations is you're looking for active bleeding in a first aid situation, always treated first. You're looking for signs and symptoms of a heart attack. Anyone that is having a breathing emergency, whether it be shortness of breath in any way, from choking, drowning, cardiac emergencies, you have about 3 minutes to act. And luckily, we're very wired appropriately in our bodies. We're going to see something, we're going to recognize it, and we're going to pick up that phone and call 911. And it's truly life-saving. Not just only in our city of Ventura, but for all of Ventura County, the response teams are phenomenal. So let's talk about some of the signs and symptoms of a heart attack. If you can imagine, there's something going on that's caused an interruption of blood flow to the heart, and there could be multiple different reasons. It could be something of a narrowing of an artery. It could be something where there's an actual clot or blockage or plaque blocking the artery. It can be something as intense as an actual trauma to the heart that severs an artery. So all these different things usually that can be severely acute, right? It's happening right now. All kinds of different reasons. You can also have some of the more chronic situations you get into that could be related to drug abuse. It could be related to genetic dispositions that we may have, congenital disorders. So they can present, though, very similar. So going over that, I brought my little wipe off board. I hadn't used this in a while from some of my classes with the hospital and the Red Cross. But it's always good to kind of see things very simply and in our brain and what we're looking for. So we want to think about signs and symptoms. So for instance, you're at home and you're with one of your loved ones and you're having a get-together, and you realize as you look across the room at your loved one that they're clasping at their chest. So some things are very obvious. Someone clasping at their chest is definitely something you would signal your brain, hey, something's just not right here. But things aren't always that obvious. So in thinking about signs and symptoms of a heart attack, it takes a little deeper level of understanding to say, hey, what am I looking for physically too? They can be very vague. They can be very different by gender. Men, kind of textbook, all this information over the years, kind of more based on men. We learned that women, they have just the opposite kind of happen. I'll go into that with symptoms. But most of these are pretty generalized. If they were to be 2 or more, again, picking up the phone, call 911. I'm not going to second guess it. So what are the most common ones we hear? The most common one most people think about is chest pain. That's usually my first response when I hear from some of the students that we work with in our advanced cardiac life support teams and basic life support teams. Oh, they're having chest pain. Well, sometimes. Sometimes you'll hear them say something as simple as they just have pressure. Women, very common. I just feel heavy in my chest. Or I'm having this kind of like indigestion, burning sensation in my chest. I took some Tums, didn't really go away. I even took maybe some medication that my doctor gave me for my belly problems that sometimes causes me indigestion. Right? We hear people say they get diagnosed with GERD, gastroesophageal reflux disease. They even took that medicine, it didn't work. So that's a red flag. So that can be a symptom. The other one, super common, tightness. I was thinking about class the last couple of days and thinking about teaching, and I'm like, over the years, what have I heard? In the most common, hundreds of different situations of symptoms with heart attacks. I've heard elephant on my chest. I've heard it feels like there's a belt tightening around my chest. I've heard it's tingling and pain, and it's pain that's shooting down my arm, or it's shooting across to the right side and into my back. Very common in women. We don't know why. Totally different, right? Men, it'll come up into their jaw, into their teeth. I'll never forget, I even had a patient years ago in one of our cardiology clinics with Ventura Cardiology who said he'd reach up underneath a car. He was a mechanic, and all of a sudden he would have this pain and the sense of fullness coming up into his jaw. All right, so if you move musculoskeletal and it recreates pain, that could be musculoskeletal. But if you're doing that and you're experiencing it and it's a burning sensation, it's indigestion, you would recognize it. You're like, that's not normal. But not always. Not everybody has chest pain. What about shortness of breath? Definitely. If anything, I would say most people start to have almost a shortness of breath out of fear. Right? So very connected to our nervous system. The biggest nerve, you start to kind of hyperventilate out of fear, but also the fact that you are not getting that pumping mechanism of the heart, there's not enough oxygen going back out to the body, they will have shortness of breath. So 2 major things I always tell everyone: shortness of breath and chest pain are never okay. Let's say you're that person, you've even had COVID, you've had pneumonia, you're a crazy weightlifter, you've been doing all these things. You can like kind of almost give yourself excuses to look at it. If you have chest pain and shortness of breath, that's usually not a good thing ever. So that's a big red flag. But the other one that coincides oftentimes, especially for the female gender, is this sudden unexplained fatigue. And we're not talking about fatigue that just kind of happens when you haven't had enough sleep, that you could name. You can name your fatigue because of a specific reason. Well, I was up at 2 a.m., taking care of my sick child or my sick parent, or, I didn't, get to sleep until 1 a.m. because we stayed up watching television or reading a book, and I'm back up at 6 a.m. So you can't name the fatigue, and the fatigue is highly unusual. One of the ways we kind of gauge it is, can you pick up a bag of groceries and bolt up a flight of stairs and not have this like sudden, I got to sit down and sit everything down. I think of over the years, some of the situations I've heard of, hey, I'm usually able to pick up my toolbox and throw it into the back of my truck and kind of work heavy labor all day. And this person says, I couldn't even lift the box. So it's a sudden fatigue. It's this highly unusual. It's not, I worked out really hard, or, I've gone and have been under tremendous stress and I haven't slept. That's never good for your heart either. We'll remember that, especially when we talk about integrative approaches that last week here at the month. But you want to be able to recognize sudden fatigue. It's almost this heavy, unexplainable fatigue. The other ones, dizzy, lightheaded, weak. Very common. No matter what gender. I don't know, I'm kind of dizzy. I even feel like my heart is beating irregularly. So you hear people say sometimes I have an irregular heartbeat. You want to look immediately and you say, hey, do you need to, is your blood sugar low? When's the last time you had something to eat or drink? You want to maybe see if they have any sort of underlying health conditions right away that would explain it, possibly a blood sugar issue. Otherwise, we would never want you giving anyone in any emergency anything to eat or drink. But sometimes people will translate to you very quickly, hey, you know what, I have diabetes, hand me some juice, I'm going to drink this fruit juice, and they'll kind of immediately perk up, right? So that one symptom of dizziness or lightheaded, not necessarily a heart attack, but it is one of the symptoms that can show you the signs and symptoms of heart attack. Lightheaded, weak, again, lightheaded, people start to kind of hyperventilate. So what am I looking for physically a lot of times in just those first 3 symptoms? Skin pallor. Skin pallor. How do they look physically to me when I observe them? I like to wear this shirt when I teach about this. When someone starts to turn this kind of ash gray color, things are bad. It's bluish, they're really bad. So in truthfulness of kind of recognizing the emergency, you are looking at someone and how are they presenting to you physically? Are they nice and pink in the cheeks? I like to say we all get flushed and blushed, and then you see us all kind of turn white and pale. And then if we don't start to kind of perk up and get a little pink back in our cheeks, you'll see this pallor of gray. Okay, that's a big flag to you. Usually it's not enough oxygen. So if I see that and someone says, I just don't feel well, I'm calling 911. I need people here to back me up. I'm not going to carry this burden of trying to figure out what this is, okay, because it can be very big. The other physical symptom, a lot of times, nausea and vomiting, especially in men. Chest pain, nausea and vomiting, my brain automatically, I'm thinking heart attack. So in looking for the seriousness and the acuteness of the situation, if someone presents to me and they say to me as they're standing in my kitchen, oh, my chest, I feel like there's an elephant on my chest, and I see them turning gray and they're starting to kind of gag and say they need to throw up, I am already on the phone, picking up the phone and calling 911. So that's a very common one. Women, yeah, too. You'll see it in both. The body, one of natural, we're like every other mammal out there. Our body will go to get rid of any waste when something internal emergent is going on, right? So we'll have oftentimes diarrhea, we'll have nausea, vomiting. Also, a lot of times, part of the nervous system. What's one of the other things besides skin pallor you will see? Profuse sweating. And when we say profuse sweating, it looks like the person in a matter of a minute is drenched, they've run a marathon. So super, super telltale sign of any emergency for someone, or that the body is having a hard time acclimating. It's what we love that word, homeostasis, balance, heart rate, blood pressure, breathing, balance, proprioception, where am I in space, where's my body in space? When those things start to get out of whack, you will see the body start to almost take shock-like symptoms. The person gets that 4-mile-away stare, and you'll see sweat just dripping down their body. Oh man, I'm picking up the phone. This is not good, right? So especially for any of us kind of in the general public setting. The other thing people complain of, sense of doom or fear. You are wired, I like this as number 6 on here, because this is truly your 6th sense, right? You are wired in your nervous system when you know your body better than anyone. You know your body better than your physician, you know your body better than your spouse, you know your body better than your parent. Anyone that is within like any presence of kind of knowing themselves recognizes, wow, my chest is hurting, or I'm dizzy. So pay attention and listen to that. The other part is you will have your body tell you red flag. And the term often is you'll hear, I have a sense of doom, or something's just not right, or something's really wrong. There's something going on. You will hear that women may be a little more attuned to this than men. We don't know why. I've had plenty of men tell me the exact same thing, patients over the years. No, this is not normal. Which brings me to, what about those people that tell you, no, I've had a heart attack. This isn't anything like the heart attack I had. No, can completely present differently. So just remember, you want that person to kind of present with what their symptoms are. You go based off of symptoms. You have the team arrive, the EMS team, that's our first responder team, I should say, that is automatically going to start running some tests and kind of see more what's happening. The sweatiness, I want to point that out again. It's like hand in hand, any gender. You'll kind of see that clammy, cold, sweaty situation. Sometimes jaw, neck, shoulder, back pain. With women, super common. My chest is hurting right here at my heart, and it's shooting over the right side of my back. Or when I go on my workout and I'm walking, I feel extreme fatigue and a little bit of shortness of breath. So just little red flags to look for. So these are some of the things we're looking for as far as recognizing it could be a heart attack. What do we do in the interim if we're waiting for EMS to arrive? How do we respond? Again, the fact that you've called 911 after recognizing it is you being the first responder. Absolutely key in this situation. You're truly a lifesaver. The other thing to remember, should we maybe get that person down on the ground? Yes. And there's a controversy going on out there amongst some of the American Heart Association and American Red Cross and a couple other first responder like cardiac life-saving teams and how we teach this. You will have people say, oh, that will make someone feel fearful. You should let them sit in a chair or lie down on the couch. And most of us in medicine know, is that the best place to be doing CPR in case that person goes into cardiac arrest? No, never. Is there a chance the person could fall off the couch or fall off the chair and hit their head? Absolutely. Where do we need someone, just in case, between the ambulance or paramedics arriving and you have to start CPR, where do we need them? We need them on the floor, on a firm surface. Beds do not count, cots do not count, couches, chairs, whatever you like to say, even those that have a hard time getting to the ground, you need to get them to the ground in case you have to start CPR. And that's a whole other class we could do. But get them on the ground, get them on their left side. A lot of us like the recovery position on our left side. We want that in case they're nauseous and they start to vomit. We don't want any choking hazard. You roll on the left side, you bend the knees very deeply. I always say pretend a child is sitting on your lap. Bend the knees up, you get a nice little flow there. Over on the left side, for a lot of us, especially the boys or the men, the right lung's a little bigger than the left. You're able to have them kind of take a couple of nice deep breaths if they can. Oftentimes in a heart attack, that's when you'll notice that they do have a hard time breathing. It helps with breathing a bit and blood flow to the heart. In the interim of that situation, once they are on the floor and there's not a danger of them falling and hitting their head, what else do? You might want to start to loosen any clothing that is on them. They might be feeling really cold and chilled because they're sweaty, and that wet clothing will keep them feeling that way. Grab a blanket. Allow them, if they're okay with it, to put the blanket over them. What else should you do? Should you give them anything to eat or drink? Absolutely not. Okay, why are we worried about that? Well, if they have to go to surgery, we don't want anything in their belly, right? Anything in our belly, be it water, food, anything like that, we're concerned about a choking hazard always. Okay, you have to be intubated, you have to go on a breathing machine, you have to have sedation. We don't want that to happen. Any chance of choking. What's something else we could do? You would want to briefly ask them if they're on any heart or blood pressure medications, if they have any heart history, if they're allergic to aspirin. And you want to ask if they're allergic to aspirin. If they're not, you're giving them an adult strength aspirin. So people have this misconception about, oh, it prevents a heart attack. There's not the science behind that. What it does do, it is help treats a heart attack when it is happening. And there's really not safety issues in regards to aspirin for someone. I recently asked one of the cardiologists this, if there was any documented cases in the past 20 years of any loss of life from aspirin, and there is not. So why do we want you to chew an aspirin up, right? You got an adult strength first aid kit, keep it in your first aid kits, chew it up, a little swish of water, because ew, it's gross, get it in their system. Because in that time period that you've recognized it, you give them an aspirin, paramedics are on their way, you're thinning out the platelets of the blood just a little bit, thinning them out. And if by chance that heart blockage is caused by this thickening blood at that space, or a clot, you're wanting to thin the sticky part of the blood, the platelets, so that when they go in there, things are a little easier to work with. As one of the cardiologists says, you want it less hostile. We need a less hostile environment. That inflammatory response, which is one of the number one causes of heart attacks and heart disease. We'll get in, that's again, another class. So responding, key things to remember, call 911, 2 or more symptoms, all right? Keep an eye on the person. Do not leave them. You want to make sure that you don't give false hope. I always say be truthful and honest with people. Say, I'm not going to leave you. Help is on the way. You don't kind of act like everything's rainbows and Care Bears and unicorns and say, it's all okay, because we don't know that. Okay? You're just saying, I've called for help, and we're doing everything we can. Last thing to remember as we close up here for heart attacks. It's really important to not let people talk you out of calling 911. There's a lot of times you'll hear us say reasons we don't want you to abuse the 911 system. A heart attack is not one of them. Especially the past year, what we've learned is people kind of putting things off or procrastinating with symptoms. Pick up the phone and call 911. All right, start that process of getting evaluated. To rule it in or rule it out, it's a win-win. Every minute is muscle. For every minute that passes that someone's having a heart attack, you're losing that pumping strength of that muscle in the heart. And you don't want that. It's harder to come back from, especially as we get older, especially if we're already having underlying health situations and diagnoses. You're going through chemotherapy treatment, you're maybe recovering from surgery. The heart in and of itself, as we age, you can almost think of it kind of like a motor. It does get wear and tear. So kind of acting quickly is always going to be one of the best things to take care of your heart. If you have questions, feel free to add in at the comments here. I want to add again the importance of, if you're questioning any of your own health, that you could get in and see our nurse practitioner. Her phone number, Andrea, is 805-667-2818. Over many years, she has been one of the greatest mentors I've ever worked with. When I was young, she was one of the head nurses in our coronary care unit and intensive care unit. She has every type of experience you can imagine. And has just a beautiful heart herself. to take care of others' hearts. We have a registered dietitian, Melissa Davidson, and of course a whole team with Health Aware of Wellness instructors. A few of us actually in years of nursing have kind of moved forward into integrative health practice. That is more of our approach, where we're taking everything we know in Western medicine and complementing it with what we know with basics of our health. Would love to have you join us for all our other classes. I will be teaching the next few Saturdays at 9 a.m. here live. You can always go back and watch it later. Yoga specifically for your heart. Deeply meaningful to me and to those I love and care about, and so I would love to have you join us. Really important to take care of your hearts. February this year of all times is something that, or a time, not something, a place and time that we all need a little extra care for our hearts. Thank you for joining me today, and I hope this was helpful to you. Again, feel free to leave some comments, and I look forward to following up with all you guys the rest of the month. Take care.